All right, let's talk root canals. Yeah, I know, just hearing the words can make a lot of us cringe a little bit. But have you ever wondered what's actually going on in there during the most critical part of the procedure? Today, we're going to pull back the curtain and demystify the core process of cleaning and shaping the inside of a tooth.
So, what's the real mission here? What is a dentist really trying to do deep inside that tooth? I'll tell you this, it's way more than just drilling a hole. It's actually a mission of microscale exploration and, most importantly, disinfection. And this image just says it all. We might picture the inside of a tooth root as just some simple, straight pipe. But the reality? It's this. A microscopic maze, a complex labyrinth of tiny fins, webs, and extra canals. It's a whole world in there. And here's the problem we're trying to solve. The whole reason for a root canal in the first place is that a bacterial infection has moved in and taken over this incredibly complex inner network. And to save the tooth, you have to get them out. Every last one. So, how in the world do you fight a hidden enemy inside a microscopic maze?
Well, the strategy is actually pretty elegant. It has two distinct goals, but they're both part of one single mission.
Let's break this down. On one side, you have shaping. This is the mechanical part, right? Using these tiny, super flexible files to carefully make the main pathways a little wider. But here's the key. Shaping isn't the end goal. It's what makes the second part, cleaning, possible. And that's where a liquid disinfectant, an irrigant, is used to flush everything out, kill all the microbes, and dissolve any infected tissue the files just can't reach. And that brings us to this absolutely perfect quote from one of the foundational textbooks in dentistry. It just nails the whole philosophy. The files, the instruments, they create the shape. But it's the liquid, the irrigant, that does the actual cleaning. You absolutely cannot have one without the other. And what's so cool is just how much work that disinfectant flush is doing. I mean, it's not just rinsing. It's flushing out all the little shavings and debris that the files create. It's dissolving leftover tissue, it's killing the bacteria, and get this, it even lubricates the instruments, making the whole shaping process go smoother and safer. It's really the MVP of the entire procedure. Okay, so we know the goals. How do dentists actually navigate this maze? Let's look at the first big strategy. You can think of it as the bottom-up approach. It's called the step-back technique. So the idea here is to go straight to the very end of the root canal, the apical area, and secure it first. Dentists use tiny files to clean and shape that narrowest part right at the tip. Then they use bigger and bigger files that step back up the canal, essentially flaring it out from the bottom up. And this diagram shows it perfectly. See how that first file goes all the way to the end? That's your master apical file. Then, as you move along, each new file is a bit bigger, but it's used at a slightly shorter length. It literally steps back, and that's what creates that nice, continuous, tapered shape. But every technique has its trade-offs. The step-back method is great for creating a solid barrier at the root's tip, and it works really well in very fine canals. The downside? Well, because you're working from the bottom up in a contaminated space, there's a chance you could accidentally push some of that infected gunk out past the end of the root. Plus, it's harder for that all-important disinfectant to get to the tip in the early stages. So, if that was bottom up, what about starting from the top? This brings us to the next strategy, which was really developed to tackle some of those downsides. It's called the crown-down technique, and it's a totally different way of thinking. Just like the name says, this method clears out the wider upper part of the canal first, the part closest to the crown of the tooth. Think of it like this. You're clearing the entryway and the main hallways of the maze before you try to navigate those tiny little rooms at the very end. This diagram shows the logic beautifully. You start by widening the top part. This creates a little reservoir for that cleaning liquid and gets a bunch of obstructions out of the way. That gives the dentist so much better control and flushing power as they work their way deeper, down to the middle, and finally to the very tip of the root. Now, the real genius of this approach is how its pros directly cancel out the cons of the step-back method. By clearing the top first, you slash the risk of pushing debris out the tip. That crucial disinfectant gets deeper much earlier, and the dentist just has better control of their instruments. The main trade-off? It can sometimes take a little more time. But what if you have a really tricky canal? Maybe one with a sharp curve. For situations like that, there's a third, more specialized method. It needs a very specific tool and a unique motion. This is the balanced force technique. This isn't just another alternative. It's a precision tool for a common challenge. You see, traditional files in a curved canal can sometimes want to straighten themselves out, and that can really damage the root's natural shape. This technique lets the dentist carve away the inside of that curve while keeping the tooth's original anatomy intact.
And the key is this tool right here, the FlexR file. Look really closely at the tip. Unlike a lot of other files that have an aggressive cutting point, this one is modified. It's non-cutting. It's designed to be a pilot to safely guide the instrument along the canal's natural path, instead of trying to carve a new one. The technique itself uses this very specific motion. First, a little clockwise turn, just enough for the file's blades to kind of bite into the canal wall. Then, the real cutting happens with a counterclockwise turn, while keeping some light inward pressure. This balances the forces on the file, letting it shave away the tooth structure with incredible control. And this diagram shows that action perfectly. That controlled, counterclockwise cutting motion removes the dentin without creating all that stress that can make a file want to straighten out a curve. It just respects the tooth's original shape, which is absolutely critical for long-term success. So whether it's step back, crown down, or the balanced force technique, after all of this meticulous, microscopic work, what's the end game? Why does all this precision matter so much? The ultimate goal of all of this is to transform that infected, complicated maze into a clean, disinfected, and smoothly tapered space. It's now totally free of bacteria and shaped perfectly so it can be completely sealed off from the body. You've saved the natural tooth, and it can keep on working for years and years to come. So the next time you hear someone say root canal, I want you to think about this. Is it just some dreaded dental procedure to be scared of? Or is it actually a masterpiece of microengineering, a really remarkable effort to solve a microscopic maze and save a natural tooth? What do you think?